Candidiasis, commonly known as a yeast infection, is a prevalent condition that affects millions of women worldwide. While it is most commonly associated with the vagina, Candida infections can occur in other parts of the body as well. This presentation will provide an in-depth look at vaginal candidiasis, exploring its causes, symptoms, diagnosis, treatment options, and prevention strategies. Understanding this common condition is essential for maintaining good vaginal health and preventing recurrent infections. What is candidiasis? Candidiasis is an infection caused by a type of yeast called Candida. Candida species are a normal part of the body's flora, particularly in the mouth, throat, gut, and vagina. However, when the balance of microorganisms is disrupted, Candida can multiply excessively, leading to an infection. Vaginal candidiasis specifically refers to a yeast infection in the vagina. There are several species of Candida, but Candida albicans is the most common cause of vaginal yeast infections. While most yeast infections are not serious, they can cause significant discomfort and, in some cases, lead to more serious complications if left untreated. Epidemiology of vaginal candidiasis. Vaginal candidiasis is a common condition, particularly among women of reproductive age. It is estimated that approximately 75% of women will experience at least one episode of vaginal candidiasis in their lifetime, and 40 to 45% will have 2 or more episodes. Recurrent vaginal candidiasis, defined as 4 or more episodes in 1 year, affects about 5 to 8% of women. While candidiasis can occur at any age, it is most prevalent in women between the ages of 20 and 40. Pregnant women, women with diabetes, and those with compromised immune systems are at higher risk of developing candidiasis. Globally, candidiasis is a significant health issue, particularly in regions with high rates of HIV/AIDS, as immunocompromised individuals are more susceptible to recurrent and severe infections. However, candidiasis is widespread across all populations and is one of the most common reasons for visits to gynecologists and primary care providers. Causes of vaginal candidiasis. Vaginal candidiasis occurs when there is an overgrowth of candida in the vagina. Several factors can disrupt the normal balance of microorganisms in the vagina and increase the risk of developing a yeast infection. These factors include antibiotic use. Antibiotics can kill the beneficial bacteria, lactobacilli, in the vagina that help control the growth of candida. This disruption allows candida to multiply unchecked, leading to an infection. Hormonal changes. Fluctuations in hormone levels, such as those that occur during pregnancy, menstruation, or hormone replacement therapy, can alter the vaginal environment and promote candida overgrowth. Diabetes. Uncontrolled diabetes can lead to elevated blood sugar levels, which create a favorable environment for candida growth. Women with poorly controlled diabetes are at higher risk of developing recurrent yeast infections. Weakened immune system. Individuals with weakened immune systems, such as those with HIV/AIDS, cancer, or those taking immunosuppressive medications, are more susceptible to candida infections. High estrogen birth control pills. Oral contraceptives with high estrogen levels can contribute to an increased risk of yeast infections by altering the vaginal flora. Tight or non-breathable clothing. Wearing tight, non-breathable clothing, such as synthetic underwear or tight pants, can create a warm, moist environment that promotes yeast growth. Poor hygiene practices. Practices such as douching, using scented tampons or pads, and not changing out of wet clothing, like swimsuits, promptly can disrupt the vaginal environment and increase the risk of candidiasis. Symptoms of vaginal candidiasis. Vaginal candidiasis can cause a range of symptoms, which can vary in severity. Common symptoms include itching and irritation. Intense itching and irritation in the vaginal and vulvar area are the most common symptoms of a yeast infection. This itching can be severe and uncomfortable. Vaginal discharge. A thick, white, odorless discharge resembling cottage cheese is characteristic of vaginal candidiasis. The discharge is typically not associated with a foul odor. Redness and swelling. The vulva may become red, swollen, and sore due to the irritation caused by the infection. Pain during intercourse. Vaginal candidiasis can make intercourse painful due to the inflammation and irritation of the vaginal tissues. Burning sensation during urination. The irritation of the vaginal tissues can lead to a burning sensation when urinating, cracking or fissures. In severe cases, the skin around the vagina may crack, leading to small cuts or fissures. It's important to note that the symptoms of candidiasis can overlap with those of other vaginal infections, such as bacterial vaginosis or sexually transmitted infections, or STIs. Therefore, proper diagnosis is essential for appropriate treatment. Diagnosis of vaginal candidiasis. Diagnosing vaginal candidiasis typically involves a combination of a physical examination, a review of symptoms, and laboratory tests. Here's how healthcare providers diagnose this condition. Physical examination. A healthcare provider will examine the vaginal area for signs of redness, swelling, and discharge. They may also check for other conditions that could cause similar symptoms. Microscopic examination. A sample of vaginal discharge may be taken and examined under a microscope to identify the presence of Candida yeast cells. This test helps confirm the diagnosis. Culture test. In some cases, a culture test may be performed. This involves growing the Candida organism in a lab to identify the specific species of yeast. This is particularly useful in cases of recurrent or persistent infections. pH test. The pH of the vaginal discharge can be tested, as candidiasis typically does not raise the vaginal pH above 4.5, unlike bacterial vaginosis. Accurate diagnosis is crucial because the symptoms of candidiasis can mimic other conditions, and treatment for candidiasis differs from that of bacterial vaginosis or STIs. Treatment options for vaginal candidiasis can usually be treated effectively with antifungal medications. Treatment options vary depending on the severity of the infection and whether it is a first-time occurrence or a recurrent infection. Here are the most common treatment approaches. Over-the-counter antifungal treatments, creams and ointments. Antifungal creams and ointments are available over the counter and are applied directly to the affected area. Commonly used antifungal agents include clotrimazole, miconazole, and tioconazole. These treatments are typically used for 3 to 7 days, depending on the severity of the infection. Vaginal suppositories. These are inserted into the vagina and release medication over time. They are an effective option for treating yeast infections and are available without a prescription. Prescription antifungal medications. Oral antifungal medications. For more severe or recurrent yeast infections, healthcare providers may prescribe an oral antifungal medication, such as fluconazole or diflucan. This medication is usually taken as a single dose, although additional doses may be required for more stubborn infections. Longer course of treatment. In cases of recurrent candidiasis, a longer course of treatment may be necessary. This could involve weekly doses of fluconazole for several months or extended use of topical antifungals. Treatment for recurrent infections, maintenance therapy. For women who experience recurrent yeast infections, maintenance therapy may be recommended. This often involves taking antifungal medications once a week for several months to prevent new infections. Probiotics. Some studies suggest that probiotics, particularly those containing lactobacilli, may help restore the natural balance of bacteria in the vagina and reduce the risk of recurrent infections. Probiotics can be taken orally or applied vaginally, although more research is needed to determine the most effective strains and dosages. Home remedies. Yogurt. Yogurt contains live cultures of lactobacillus bacteria, which can help restore the balance of bacteria in the vagina. Eating yogurt or applying it topically to the affected area may provide relief from symptoms. Coconut oil. Coconut oil has antifungal properties and can be applied externally to the affected area to soothe irritation and reduce yeast growth. Garlic. Garlic is known for its antifungal properties and may be used as a natural remedy for yeast infections. However, it should be used with caution as it can cause irritation in some individuals. Preventing yeast infections involves adopting habits that help maintain a healthy balance of bacteria and yeast in the vagina. Here are some strategies to reduce the risk of developing candidiasis. Wear breathable clothing. Choose cotton underwear and avoid tight-fitting clothing, such as tight pants or synthetic fabrics, which can trap moisture and heat, creating an environment conducive to yeast growth. Practice good hygiene. Wipe from front to back after using the toilet to avoid spreading bacteria from the rectum to the vagina. Avoid using scented soaps, bubble baths, and feminine hygiene products, as these can irritate the vaginal area and disrupt the natural balance of bacteria. Avoid douching. Douching can disrupt the natural balance of bacteria in the vagina and increase the risk of yeast infections. The vagina is self-cleaning, and douching is unnecessary and potentially harmful. Control blood sugar levels. For women with diabetes, managing blood sugar levels is crucial in preventing yeast infections. High blood sugar levels can contribute to an environment that promotes Candida growth. Use high estrogen birth control pills with caution. If you are prone to yeast infections and use high estrogen birth control pills, talk to your healthcare provider about alternative contraceptive options. Limit antibiotic use. Only use antibiotics when necessary and as prescribed by a healthcare provider. Antibiotics can kill beneficial bacteria and increase the risk of yeast infections. Boost immune health. A healthy immune system helps keep Candida in check. Maintain a balanced diet, get regular exercise, and manage stress to support overall immune function. While most cases of vaginal candidiasis are mild and easily treated, complications can occur, particularly in individuals with weakened immune systems or those who experience recurrent infections. Potential complications include recurrent candidiasis. Some women experience recurrent yeast infections, defined as 4 or more episodes in 1 year. Recurrent infections can be challenging to treat and may require long-term maintenance therapy. Spread of infection. In rare cases, Candida can spread beyond the vagina to other parts of the body, particularly in individuals with weakened immune systems. This can lead to more serious infections, such as systemic candidiasis, which can affect the bloodstream and internal organs. Pregnancy complications. While vaginal candidiasis is not typically harmful during pregnancy, untreated infections can cause discomfort and may increase the risk of complications, such as preterm birth. Pregnant women with candidiasis should seek treatment to manage symptoms and reduce risks. Vaginal candidiasis is a common and often uncomfortable condition that affects millions of women worldwide. Understanding the causes, symptoms, diagnosis, and treatment options for yeast infections is crucial for maintaining good vaginal health and preventing recurrences. If you suspect you have a yeast infection, it's important to seek medical advice for an accurate diagnosis and appropriate treatment. By following preventive measures and adopting healthy habits, you can reduce your risk of developing candidiasis and enjoy better overall vaginal health.